Melissa, I'm going to be doing an abdominal assessment on my patient Ashley. I've asked her to empty her bladder before the examination to avoid urinary distension. Ashley, I'm going to ask you to lay on your back with your hands to your side. Relax in supine position. Normally we would assess on bare skin, but for privacy I'm going to assess over the shirt. So the first thing I'm going to do is do an inspection. So I'm looking for any abnormalities with color. Purplish would mean abdominal bleeding, any yellow would mean jaundice, or any red would mean inflammation. I'm also looking for any scars, stretch marks, lesions, rashes. I'm also looking for any moles, the size, color, and border of them. I'm also looking at the umbilicus to make sure it's not bluish or purple around it, making sure it's not deviated or everted. I'm also looking at her abdomen to make sure it's not distended, which could mean fluid accumulation or gas. I'm also looking to make sure it's not sunken in, which could mean weight loss or terminal illness. I'm also going to ask her to raise her head, so I'm looking for any hernias that might protrude. I'm also looking for any dilated veins. Also, I'm going to look at her breathing pattern to make sure she's breathing normally and make sure it's not diminished. I'm also looking for any aortic pulsations, which can mean an aortic aneurysm. And I'm also looking for any parasitic waves, which travel from the left upper quad to the right upper quad, which could mean bowel obstruction. Okay, the second part of my assessment, I'm going to be assessing the abdomen. I'll be using the diaphragm of my stethoscope. I'll begin listening to all four quads. Start with the right lower quad. Listen to all four quads for a minimum of a minute, maximum of 5 minutes. You usually hear bowel sounds every 5 to 15 seconds. Hyperactive bowel sounds usually high-pitched sounds. Hyperactive bowel sounds usually diminished. Or any absent bowel sounds or a medical emergency. The next part of my assessment, I'm going to use the bell of my stethoscope and assess for vascular sounds. I'm going to start with the aorta, the renal, the femoral, and the iliac. This is an important assessment to when patients have hypertension. My next part of my assessment, I'm going to also use the bell of my stethoscope and listen for the venous hum. This is in the epigastric area and the umbilical areas. The last part of my assessment, I'm going to listen for a friction rub. I'm also use the bell of my stethoscope. Listen in the right upper quad, the liver, and the left upper quad, which is the spleen. Okay, the third part of my assessment will be the percussion. So I'll put my hand over the patient's abdomen, over each quadrant, and I'm going to hear timpani sounds. Dullness can be heard over the spleen and the liver, or any bladders that are full. The next part of my assessment, I'm going to assess for the liver. So I'm going to start on the right lower quad, and I'm going to hear timpani. When you hear dullness, you're at the bottom part of the liver. So now I'm going to look for the top part, so I'm going to start here. You hear lung resonance. When you hear dullness, that is the top part of the liver. And so you mark the liver, and it's usually 6 to 12 centimeters long. Next part of my assessment, I'm going to assess for the spleen. So it's posterior left mid-axillary line. So I'm going to start here. It's going to be lung resonance. Then when I hear dullness, that's where the spleen is located. Okay, I'll begin the fourth part of my assessment, which is palpitation. I'm going to do light palpitation to make sure the patient don't have any tenderness or pain. Do you have any tenderness or pain? I'm using my fingertips. The next part of my assessment, I'm going to use deep palpitation. Use both hands. Feeling for any masses, tumors. Then I'm going to palpate the aorta, which I'm going to use my thumb and forefinger to measure. A wide bounding pulse would mean an aortic aneurysm. Next thing I'm going to do is deeply palpate the liver using both hands. And also use the hook method. Ask the patient to take a deep breath in. You press inward and upward. The next part of my assessment, I'm going to assess the spleen. It's right below the rib cage. The spleen is not usually palpable. If it is, it means the spleen is enlarged. Another alternative method would be to ask the patient to lay on their right side. And right below the rib cage, and palpate the spleen. So again, it's not usually palpable. Okay, have the patient lay on their back. Now I'm going to palpate the kidney. So I'm going to put my left arm under the patient's back, the right quad. I'm going to deeply palpate. Ask the patient to take a deep breath. You can feel the kidney. If the kidney is enlarged, it usually means a mass. This concludes my abdominal assessment. My patient Ashley. Thank you for being such a great patient. Thank you.